motion. Nice and slow and controlled. Relax a little more. There it is.
It does. It felt
right.
It felt
what about
very different.
Yeah.
Okay. I felt it all the way through my hip.
Hey guys, Dr. Clerge, a DMV chiropractor, and I'm here today with Mark. Okay, so Mark, you've never been to a chiropractor before?
No.
Okay. And basically you came in with complaints of, basically it's all upper, neck, upper traps, thoracic, that type of area, right?
That's right.
So give me some more information. What's going on?
So I think I sleep on my stomach. So every time when I wake up, I have this bad pain between my shoulder blades and my upper neck area. So I always have to like pinch my shoulders back and just to decompress that.
To decompress that.
And also gives like migraines and stuff.
I see. So and we were discussing that, previously on the issues for sleeping position, right? You're sleeping on your stomach,
right?
Okay, which is the worst position to sleep. Okay.
Okay.
First best position is on your back.
Okay.
Second best, because some people can't sleep on their back, is on your side. Okay. And when you sleep on your side, you should have maybe one or two pillows in between your legs, because that'll decrease the tension in that lower back. Okay. On your stomach is the worst position, because so basically this is your spine. This is a side view, and each segment has its own curve. So the cervical spine has its curve. The thoracic spine, which is the mid-back, there's a curve in that area here. Lower back has its own curve as well. So imagine being in this position, in a rotational position, because you can't just sleep straight down, you have to breathe, right?
Right.
So imagine being in that position for 8 hours, 7 hours, and applying pressure to all the cervical musculature. Okay, from your trapezius to your levator scapes, your SCM, and then when you get up, you have to rotate. Of course, it'll be a lot of tension. Okay, so I believe that's about 70% of your problem.
Okay.
That position. Okay. So what I need you to do is, if you can, change the position. Try sleeping on your back using a cervical pillow. Okay. It has an S shape, and I'll show you what that looks like. Okay.
Got it.
So what I want you to do is use something like this. It doesn't have to be this. All you have to do is go to Amazon, type in cervical pillow. Anything that has an S shape, it basically supports the cervical spine, okay? So, once again, this is the spine, okay? Each segment has its own curve. So what happens when we place the neck into a cervical pillow, it'll support that curve, okay? And it'll decrease the tension. So, let's try it so you can see what I'm talking about.
All right.
First, let's just have you lay back. Lay straight back. Good. How does that feel to you? I know your stomach's sleeping.
It's fine so far. I just feel like my neck is going a little bit.
Gotcha.
Fine.
Okay. So let's have you go ahead and sit back up for me. Go ahead and lay back down. Good. Yep. Good. Now lift your legs up. Drop your legs. Good. How does that position feel?
Much better.
Much better, right. So you're not rotating your neck, you're not putting all that pressure in the cervical musculature, so obviously this is supporting the cervical curve, okay, so it's less tension. And then your legs are elevated, so it's decreasing tension in the lower back. Now, you can elevate it even more, so for example, you can get a larger foam, you can put, several pillows underneath, anything to kind of decrease that tension and keep your legs elevated.
Got it.
Okay, but that feels okay for the most part?
Yes, it does.
So that's the best way to sleep.
Okay.
Try it. You may not sleep like that the whole time, but it'll help. Okay, and then you don't have to see me as often. Right?
No problem.
All right. Let's take this up. So your lower back is okay, so we'll leave that alone. We're going to focus on the upper portion, okay?
Yes.
So what I'll have you do, let's have you look down and let me know how that feels.
Feels fine.
Feels fine? Okay, let's have you extend and look back. Try and look as far back as you can. How's that?
I just I heard a click in my neck.
You heard some popping already, right?
Yes, yes.
Okay, any tension, tightness with that?
No, not really.
Not really? Okay. So now I'm going to have you rotate to the right, rotate to the left, okay? Let's start with this side first. Rotate. How's that?
I feel pulling on my left side.
Pulling on the left side. Let's go. Now, can you see behind you?
Can I see from here? Yes.
Kind of, sort of?
Yeah,
Okay.
a little bit.
A little bit.
Mhm.
Let's go to this side. You have more motion on that side now. Is this tight on this side?
No.
That's not too bad?
Mm-mm.
Okay. Your motion is actually a little bit better on the right. Now let's go back to a normal position. We're going to side bend, so lateral reflex.
Okay.
We're going to this side first. Let's go to the right. How's that?
That's fine.
That's fine?
Mhm.
Okay. You're good on time, you want to restart? Restart?
Mm-mm.
Okay. Let's go to the left side.
Yeah, I feel some pressure.
That's a little tight. Yeah, I see you training a little bit. Okay, all right. I'm going to apply pressure. Are you ready?
Yeah.
That's okay?
Yes.
Pressure. That's okay?
I feel a little bit of pressure on the left side there.
On the left side?
Mhm.
Let's go to the other side. Pressure. That's okay?
Yes, that's fine.
But no tingling down the arm, nothing like that.
No.
All right? Okay, gotcha. All right. So let's have you stand up for me. All right, so now what we're going to do, I'm going to hold on to your hips, okay? That way you're not moving your lumbars as much.
Okay.
And I'm going to have you kind of rotate, but try and keep it up top, okay?
Okay.
All right, so let's hold this. Have you move forward for me a little bit. All right, go ahead and rotate to the right for me. Good. Rotate to the other side. Good. How do you feel? How's that? Any pressure, tightness in the upper area?
No.
No. Okay. Let's have you go side to side. So you're going to this side and then that side.
Got it.
All right. So let's go ahead and go to the right. Good. Let's go to the other side. How's that?
I have to bend a little more for this one.
For this one?
Yeah.
Okay. Tightness up top?
No tightness up top.
No tightness up top. Okay. Let's have you face down for me. So you're going to be on your stomach. I'm going to apply a little bit of pressure, but I'm going to stay up top. That's okay?
Yes.
Okay. Pressure to the thoracic spine. That's okay?
Yes.
That's okay. That's a little tight? Right up here. Okay. Let's have you sit up. So basically what we're going to do first, we're going to stretch you out, okay?
Okay.
The stretches are going to focus mainly in the upper area.
Okay.
Neck, a little bit of thoracic stretches, okay? After the stretching, then you'll come back to see me to get adjusted.
Okay.
The key is to loosen you up because you've never been adjusted before. This is your first time seeing a chiropractor, right?
Right.
Okay, and then after the adjustments, we'll target the muscle.
Okay.
And I believe if you at least try to change that sleeping position, that'll take care of about 70% of the issue.
Okay.
Okay? And then what I would suggest is, you probably come see me every 3 or 4 months.
Okay.
Because I don't believe it's a major issue. I believe it's a postural issue. It's sleeping on the stomach, applying a lot of pressure to the cervical musculature, that's causing problems.
Got it.
Okay?
All right.
So this is going to focus on that mid-back area. Okay? Because I know you said you have a lot of tension.
Yeah.
Pretty often. So if you get something like that, what you want to do, you're gonna lay back. It should be around like mid-thoracic, around your mid-back.
Okay.
Then what you're going to do is elevate that lower portion of your back, and you're going to go upward and downward. Okay.
Okay.
So don't go past your mid-back.
Okay.
You want to stay in the upper area. Okay.
Got it.
And you can do that for a few minutes, 5 minutes or so. Do it to your point of tolerance, okay? So if it gets uncomfortable, then you stop.
Got it.
All right. Okay. So let's go ahead and try it. Good. All right, now. There you go, perfect. Just go ahead and lean back for me. Good. Now, you want to elevate your lower lumbars. Good. And then you want to do that up and down motion. Nice and slow and controlled. There you go. Good. How does that feel?
Feels good.
Feels pretty good.
Yeah.
So it should decrease a little bit of that tightness.
Yeah.
Sometimes you even hear some popping sometimes.
I just did.
You just did?
Yeah.
Okay, perfect. All right, okay. And once again, you do it to the point of comfort, okay?
Okay.
All right. So that's what I'm recommending for the upper back, okay? Kind of help decrease some of that tension.
Okay.
All right? Okay. All right, so now Tiana's going to take over. She's going to do a lot of stretching with the neck and then the upper portion, okay?
Okay.
All right. Okay. You can come up.
You want to take a big deep breath for me? And let it out. Okay, how's that feel?
It's okay.
It's not too tight, is it?
No.
Do you feel like we can go a little further?
Mm,
No?
no, not really.
Okay, it's fine. Okay, we're going to start again, okay? Big deep breath. Go ahead and let it out. Good. We're gonna do this one more time, okay?
Okay.
Big deep breath. Go ahead and let it out. Good. Perfect. And now I'm just gonna have you flip on your back so I can stretch your neck, okay?
Yep.
And I'm just gonna stretch your neck this way. So take a big deep breath for me and let it out. How's that?
Fine.
Okay. Big deep breath and let it out. Good. Big deep breath and let it out. Good. It's not too tight, is it?
No, it's not.
Okay. Now we're going to switch to the other side, okay? Big deep breath and let it out. Good. How's this side?
It's fine.
There you go. Big deep breath and go ahead and let it out. Good. One more time on this side, okay? Big deep breath. And go ahead and let it out. Good. Perfect. And now we're going to stretch out the shoulders, so we're actually going to go to this corner right here, okay?
Got it.
So come all the way, hands down first. Come all the way to the wall.
Oh, come on, to the wall. Got it.
Go ahead and take 2 steps back. Perfect. Now you go ahead and place your hands on the wall.
All right.
Pretty even. Good. There you go, like that. That's good. Now, listen up. Yep, good. Take a big deep breath and go ahead and push in. You're feeling that all in here, correct?
Yeah.
Good. Hold that for a second. And remember to take them breaths, okay?
Yep.
Come on now, you're going to do it again. Big deep breath before you push in. And go ahead and let it out. Good. Good. Hold it. Okay, one more time, okay?
Okay.
Big deep breath. And go ahead and let it out. Good. Is it too tight?
No, it's not.
Okay. Alright, good. Perfect. Are you all done?
All right.
So, Mark, you've never been adjusted before, right?
No.
This is your very first time?
Yes.
You seen some of the videos?
I have.
Okay. So the key is to just relax, okay?
Okay.
All right, so I'm gonna check your range of motion for the neck first, okay?
Okay.
All right. All right. So the lateral flexion is a little bit restricted. That's where we're trying to target, okay? So I'm gonna target the upper cervicals.
Okay.
All right. Okay. So this first adjustment is gonna focus on the occiput C1, C2 area. So this is the area that I'm trying to increase motion and mobility in
Okay.
those segments, okay?
Got it.
And then after that, I'll see what your motions are, and then I'll know what to do next, okay?
Got it.
All right. So what I want you to do is just relax as much as you can, okay?
Okay.
I am going to bring you to some slight rotation. Contract your occiput, drop your head in the palm of my hand, and just relax your body. Good. Relax. More, relax a little more. There it is. Yes, sir. Okay. How did that feel?
Feel good?
Was that painful?
No.
Okay. Drop your head, relax. How did that feel?
That's fine.
It's not too bad?
No.
Any pain with that?
No.
No. Now, let's have you rotate, so you're going to turn. You feel a difference as far as
It does. It feels.
Right.
It feels
What about
very different.
very different, right?
Yeah.
Let's go to the other side. Yeah.
Okay.
Can you see a difference in the rotation? Let's do that motion again. Now let me know how you can if you can see that picture behind you.
I can.
You can.
Yeah.
Right. Same thing on this side. Let's see if you can see that picture right
Yeah, okay.
here. Yeah. Compared to the initial movements,
Before,
right?
yeah.
Okay.
It feels looser.
Feels looser, right. So let's rotate. Just do this circular motion for me. Just let me know how that feels overall.
Feels fine.
Feels fine. Okay, no pain.
No.
The reason I keep asking you no pain because people think it's painful because of the cracking sound.
Oh.
Yeah, it's loud, so
It's loud, but it's not painful.
it's not painful at all.
Yeah,
And most
yeah.
people are afraid of it because they're like, oh, it's painful. It's really
Yeah,
not.
it's not painful.
It's in and out, you know.
Yeah.
All right, so I'm stand up for me. I'm gonna clean this table out real quick.
Okay.
Mhm.
You're back?
Lean back. Bring your legs up. Good. Okay. Now, what you want to do is just relax.
I feel it.
You feel? I heard a pop already. Is that uncomfortable?
No, not really. Just
Not
feel
really.
the pulling.
You're gonna feel the pulling sensation, right? Yeah, your mat's probably gonna slide up from.
Yeah.
Yeah.
That's fine. Whatever.
Take a deep breath. Let it out. Good. So let that go for a little bit. All right. Take one big breath. Out. Yes, sir. How do you feel?
I felt it all the way through my hips.
I heard it all the way.
My gosh.
Yeah. So what's gonna happen is we're gonna bring you up in a few minutes. All
Okay.
right. Let's bring this down. This side. There you go. Good. All right. Now, so just move your head and neck around for me. Just move around overall. How does that feel?
Feels better than before.
Feels better than before. Yeah, you're moving a little bit better. That's for sure. Let's have you stand up, move around for me. So, just move around. Move your head and neck.
Feels looser in the middle.
In the middle, yeah. Well, we just distracted
Yeah,
the whole
yeah.
spine, you know. So, yeah. So, what we're going to do next, okay? So now we took care of the spinal portion. We still have to take care of the muscle because this is still tight, especially in that area right here, okay? So they're going to do massages for you,
Okay.
okay? And they'll massage from the neck down to the mid back. I'm actually even gonna have them do the lower back, even though you're not having any issue. But
Right.
since you're here, we might as well take care of that muscle as well.
Gotcha.
So this whole portion right here. Okay.
Alright.
After the massage, they'll put you on some stim, electrical muscle stimulation, to stimulate the muscle.
Okay.
And a traction table, and a similar traction table to even increase more motion.
Okay.
Create more motion. Okay.
All right, no problem.
All right. Perfect.